Hi, my name is Jessica Gletta, and today I will be doing medication administration for my final critique. So, I'm just going to get started first with just my knowledge on the drugs. So I have a cue card here. I can't see if you see it with all my information. So the drug we'll be administering today is acetaminophen. So that's the generic name, and the brand name is Tylenol. The classification is a therapeutic antipyretic, which reduces fever, and it's a non-opioid analgesic. Again, I can never say that word. It's used for pain and inflammation. So there are 3 routes. You could do PO, which is by mouth, PR, which is by rectum, and then IV, which is intravenous. For PO by mouth, the onset is 30 minutes to an hour, the peak is an hour to 3 hours, and the duration is 3 to 8 hours. But PR by rectum is onset 30 minutes to an hour, peak is 1 to 3 hours, and duration is 3 to 4 hours. And for intravenous, onset is 30 minutes, the peak is 30 minutes, and the duration is 4 to 6 hours. For health teaching, I'll be giving 2 health teachings. So I would tell the patient to take the acetaminophen with a full glass of water, because if you drink all the water, then it's a rapid absorption, which causes it to work faster. And I would also tell them that there are technically no side effects with acetaminophen, but if you were to get a fever, rash, or hives, and difficulty swallowing, that you should immediately call your nurse. So for the adverse reactions, anxiety, agitation, headache, fatigue, insomnia, hypertension, hypotension, and then for the contraindications, any previous hypersensitivity to products that have alcohol, aspartame, or sugar should be noted. Okay, so I'm going to put that aside. The next thing I'm going to do is, I don't need that. The next thing I'm going to do is go over my medication policy. Every hospital has a different policy, so you want to make sure that you are following the right one with the right hospital. The next thing I'm going to do, this is my chart. So I have my chart here, and I have my MAR. So for the chart, most charts have a signature sheet in it, so I'm going to go into mine and fill it out. Okay, so the date is April 13th. My name is Jessica Gletta. I'm gonna put my status as PN2, Practical Nursing Semester 2. Sign it, and then initial it JG. The next thing I'm gonna do is compare my MAR to the doctor's orders. So again, there is the doctor's orders. And there is the MAR. So I see here that my patient is Sid Garland. I see that the allergies are penicillin and codeine. I see that the drug is acetaminophen. I can see that the route is by mouth, and here it's saying by mouth or by rectum. I'm seeing the frequency is 6 hours, and on the doctor's note it says 6 hours. The directions on the MAR are do not exceed 4 grams per day for 4 days, and then this one says as needed for pain for 4 days. They also have the right birthday, which is 11/08/1965, 11/08/1965, and 344316 as their M number, and 344316 as their M number. So these are the exact same, so that's perfect. The next thing I'm going to do is take a worksheet, which I have right here, just a blank piece of paper. So for my worksheet, and I'm going to take my patient's chart, and I'm just going to write down a medical history, and this is what I'll be using when going into the room with the actual patient to administer the medication. So I see here my patient is Sid Garland. He's admitted for a below knee amputation. He's allergic to penicillin and codeine. Okay, his medical number is 344316. Okay, so now that I have all of that, I'm going to do a pre-assessment of my patient. when I do a pre-assessment, I'm going to be looking at the patient's labs to make sure they're normal. I'm going to be making sure that their vital signs are normal. I'm going to ask a pain scale. This is important because then you know how your patient's feeling. So my patient said on a scale of 1 to 10, 10 being the worst, he's about a 5, so that's why we are giving the medication. I'm also going to make sure that he can swallow because the doctor's orders did say that I could do it by rectum if he was unable to swallow. In my situation, my patient's able to swallow, so I'm going to give it by mouth. Okay, so have that. This is a chart. I'm going to just keep it over here, and that's what I'll be bringing into the room with me. Once I've done that, I'm going to get my medication. So I have it here. I'm going to wash my hands, make sure that the date is correct, like the expiry date, and it is. This doesn't expire until February 2022. And I have my little medication cup. This won't be used yet. And I have the right medication. So once I do that, I'm going to take the medication and compare it to my MAR to make sure. Okay. So here I have the patient is Sid Garland. I know this is Sid Garland because I got it out of his drawer. So even though it is an on-the-shelf drug, I got it from his drawer. I know it belongs to him. So Sid Garland belongs to Sid Garland. The drug is acetaminophen Tylenol. The dose is 650. In my case, it's 325, so I'll have to do a calculation. The route is by mouth. I'll give this by mouth. The frequency is 6 hours. I will give this every 6 hours. I can give it between the time 2400, 0600, 1200, and 1800. And the reason is for pain. Immediately after doing my first check, I'm going straight into my second check. So again, we'll do it again. Sid Garland. I know this is Sid Garland because I got it from his drawer. The drug is acetaminophen, also known as Tylenol. The dose is 650. In my case, it's 325, so I'll do a calculation. The route is by mouth. And the frequency is every 6 hours. I'll give this every 6 hours. I can give it at 2400. 0600, 1200, and 1800. In this case, it hasn't been given at 600, so I'll give it now. And the reason is for pain. So once I've done my 2 checks, I'm then going to do my calculation. So I'm just going to take an empty little piece of paper here and do my calculation. So it's a pretty simple equation, but and you can do it in your head. However, I'm going to use a calculator just to confirm. So the calculation is D over A, so desired over actual, times hours, so 1, and then equals, so in our case it's 650 divided by 325 times 1. I'll put that in my calculator. Is 2 tablets. And I'll put a box around it. Okay, and so if you need to see there it is, so I got 2 tablets as my answer. Once I've done that, I'm going straight into my third check. No, I'm not. Sorry. I'm going to prepare the medication first. I realized that just as I picked up the MAR, I'm like, nope, not yet. So every medication will have a child lock. So line it up, maintaining a clean asepsis. You're going to put 2 into the lid. Okay, so I have 2. Put them into my medication lid. Okay, there's my medication. Okay, and now I'm going to go straight into my third check. So, open my MAR again. Okay, so here we go again. Sid Garland. This was taken out of Sid Garland's drawer, so I know it belongs to him. The drug is acetaminophen, also known as Tylenol. Says Tylenol. The dose is 650. The dose here is 325. However, we did a calculation and we got 2 tablets. The frequency is 6 hours. I'll give this every 6 hours. The route is by mouth. I'll give this by mouth. And it can be given at 2400, 0600, 1200, and 1800. It hasn't been given at 0600 yet. That's the time. I'm giving it now. And the reason is for pain. So once I've done that, I'm actually going to redo the calculation. So I'm just going to flip it. It's empty on the back. So again, I know that it's desired over actual times 1. And then again, that is 650 milligrams divided by 325 milligrams. And then times 1 is going to equal Again, I'm going to do it on my calculator, even though I know 650 divided by 325 gives me, again, times 1. Yep, again, gives me 2 tablets. So now I know that is correct. You can see it again. So I have it on both sides, 2 calculations. The next thing I'm going to do is call my teacher over to make sure that this is all correct. Obviously, because I am a student, I do need the extra assistance to make sure that it is correct. So the teacher's come over, she's confirmed that I've done all the right steps, that I know what's going on. She's also rechecked my calculation, and she has said yes. So that's perfect. The next thing I'm going to do is introduce myself to the patient. So I say that my name is Jessica. I am a second semester practical nursing student at Durham College, and I would explain that I was giving them Tylenol for their pain and ask if that's okay. Once I've obtained consent, then I'm just going to do my bedside basics, which means the environmental check. I'm just going to make sure that my curtain is drawn, that my 4 bed breaks are on, that my 2 rails are up, that my patient's in the lowest position, that their oxygen suction is working, that their call bell is in place, and that all 4 rails aren't up. Once I've checked that, I know that it's good. I'm going to properly identify the patient. That, again, it's super, super important to make sure you have the right patient and you're not administering the wrong meds to the wrong person. So I would do that by checking their wristband. I already see it on my chart. I know their M number, I know their name and their allergies, but I'm still going to check on their wristband, their date of birth, their M number, their allergies, and their name. And I'm going to clarify with the patient that their name, their date of birth, and their allergies. Verify all of that. I verified 3 times so I know for sure that that is my patient. And once I've done that, the most important thing is that I'm going to ask about allergies, and then I will reassure the patient that acetaminophen has nothing to do with codeine or penicillin. However, if they did have any swallowing problems after, fever, rash, hives, that they should call me. I would do health teaching after, so I would say that acetaminophen can be taken with, or should be taken with, a full glass of water. That way that the absorption is a lot faster. And I would tell them, again, that there are usually no side effects with acetaminophen. However, if they did have an issue, that they would call me. After that, I would administer them. So I would put the patient up into high Fowlers, so 90 degrees, and I would give them a glass of water, and I would let them drink it. And I'd wait until I knew that they had fully taken the medication. After I'd done that, I will document it. So I actually have in here documentation sheet. It's in the MAR. Here we go. So I'm going to document it. So the date is April 13th. And I would have my teacher sign off of it if I needed to sign off. After that, I would wait and I would do a post-assessment to make sure that everything was okay and that my patient was feeling okay. And I would also assess their pain to see if their pain level had gone down after taking the medication. And that's all.